Welcome to this talk. We're looking at peripheral vascular disease. Now, peripheral vascular disease could be more accurately referred to as peripheral arterial disease, because it's possible to get disease of the peripheral veins as well as of the peripheral arteries. So when we talk about peripheral vascular disease, we're actually talking about peripheral arterial disease. Let's think about the normal situation first of all. Arteries, of course, derive from the left ventricle, from the aorta. They break down into smaller arterial vessels. And then these arterial vessels break down into smaller arterial vessels, which will break down into smaller arterial vessels. Ultimately, breaking down into the arterioles, which perfuse the capillaries. The capillaries are the area where exchange of gases and nutrients take place to nourish the tissues and to remove the dead products, not the dead products, the waste products like carbon dioxide from the tissues. So absolutely vital that the blood is getting to the tissues. Without this, a tissue is not viable. The pressure here is high because it's generated by the left ventricle, and of course any fluid, blood is a fluid of course, moves from areas of high pressure to areas of low pressure. So if the pressure here is higher than here, the blood will move to areas of low pressure. So the blood moves from areas of high pressure to areas of low pressure. So what an artery does is it actually perfuses an area of tissue. If this sounds familiar to you, that's fine. We've covered this on videos like the cardiovascular system, because the physiology and the pathology is very similar. So here we have areas of tissue. This area of tissue here is perfused by this arterial branch. Now there is a slight difference between the heart muscle and the leg muscles. In the heart muscle there is not much collateral circulation. That means there's only one way for the blood to get to a particular area of tissue. And if that one way is cut off, then this area of tissue will necrose, it will die. But in the limbs, there is a fair degree of collateral circulation. There's two large arteries in the lower leg, for example. And if one of them becomes blocked off, then the leg can still be perfused to a degree via the other artery. It's as if there's a kind of a spare way or an alternative route for the blood to get there. So disease in one vessel in the leg might not necessarily result in significant peripheral vascular disease, because the blood can go around a collateral route, a collateral route. There are limits to that, of course. Can you see that the perfusion of an area of tissue depends on the fact that the arterial lumen is patent? And of course, one of the big problems is these days in the Western world, and increasingly in the developing world, as the developing world adopts Western lifestyles, we get accumulation of fatty deposits in the lumen of the arteries. So there is accumulation of fatty material in the lumen of the arteries, largely made up of cholesterol, depositing itself into the lining of the arterial vessels, occluding the lumen. So I think now you can probably see that the lumen of this vessel is only as wide as from there to there, whereas it was as wide as from there to there. There's narrowing and irregularity now in the lumen of the vessel. So that was the previous lumen. This is the current lumen. The accumulation of this fatty material in the arterial vessels, well, the material itself is called atheroma. So atheroma is this pathological, abnormal material laid down in the lumen of the arterial vessels. The disease process is referred to as atherosclerosis. So in atherosclerosis, there is deposition of atheroma in the lumen of the vessels. Now, one effect this has is that because the lumen is narrowed, there's going to be less blood getting through to the tissues which are distal to the arterial narrowing. What do we call a tissue which has a reduced blood supply? How do we describe that? Well, we say that tissue is ischemic. So there is ischemia. There's a reduced blood supply to the tissue normally perfused by that arterial branch. Now, in addition, because there's irregularities in the wall and there can be turbulence, you can actually get a blood clot which completely occludes the arterial lumen. What do we call a blood clot that develops inside a blood vessel? That's called a thrombosis. So a thrombosis can develop. Ischemia and thrombosis, both complications of the atheroma. The third complication of atheroma is that the wall of the blood vessels can be weakened, causing aneurysm. That can ultimately lead to the rupture of a blood vessel. This can occur in the aorta, for example. So all arteries can become atheromatous, and this certainly includes the peripheral arteries, particularly the arteries that supply blood to the legs. So in peripheral vascular disease, the main pathology is atherosclerosis, the accumulation of atheroma in the arteries that supply the leg, giving rise to three complications: ischemia, thrombosis, and possible aneurysm. Now, when people suffer from peripheral vascular disease, sometimes it's necessary to identify where the lesions are in the leg so that it can be treated. And for this reason, angiography, looking at the blood vessels under X-ray, is sometimes performed. So to illustrate the principle that we've looked at here, let's now look at a few real cases. What we're looking at here is an X-ray of the femur and the femoral artery, which has been illuminated with radio-opaque dye. Here you can see some small blood vessels leaving the femoral artery. Now, there does seem to be some minor occlusion into the lumen of the artery at about this level here. But if we look at the artery distal to that, the amount of blood does seem to be quite reasonable still in the femoral artery. As we go further down, I think you can see here there's a more severe narrowing of the artery, and this is presumably due to atheromatous plaques pushing in from both sides into the lumen of the artery resulting in arterial narrowing. You can see other intrusions into the artery there. Then if you see there around about the level of the knee, I think you can see here that vessels are leaving the femoral artery, carrying some blood further down the leg. But the main body of the artery itself seems to be occluded completely just here. So the limb is only being perfused by these smaller vessels. So a fairly major occlusion in the femoral artery there, round about the level of the knee. And of course this is going to have significant effects on the lower limb, leading to hypoperfusion and ischemic changes. Again here we can clearly see the femur on the left and a very poor quality looking femoral artery on the right. And indeed just about there, here, I think you can see that the artery is occluded completely. You can see blood leaving here in smaller vessels. Then as we go further down, a strange thing happens. We can pick up the line of the femoral artery here again. This is because the femoral artery has been somewhat reperfused by the collateral circulation. Other arterial vessels have carried blood into it. As we go down, we can see that the femoral artery is really quite narrowed, and this will result in limb ischemia. Here we see another example. Again, the femoral artery is illuminated. And as we go down, well, there we can see a very clear narrowing at this point. And again here. So again, disease of the artery resulting in limb ischemia. Let's now think about the etiology of peripheral vascular disease. Now, people classify peripheral vascular disease in different ways. Very often it's classified according to its severity. Maybe mild peripheral ischemia or more severe peripheral ischemia. Or sometimes people talk about critical limb ischemia. Critical limb ischemia means that the condition has become severe and needs management interventions straight away. But for the benefit of talking about the etiology of the condition, I think it's probably helpful to divide it into another classification, acute and chronic. So let's go on and think about the etiology of peripheral vascular disease in terms of acute and chronic. So we're thinking about the etiology of peripheral vascular disease. Chronic, etiology of the chronic disorder, and etiology of the acute disorder. Now, the etiology of chronic peripheral vascular disease is very much the same as the etiology of any form of atheroma. So certainly diet is going to be an etiological factor. People who eat a lot of fat or a lot of sugar. People who don't eat enough fresh fruit and vegetables. Remember, you should eat at least 5 portions of fresh fruit and vegetables a day. 5 a day, probably even more. We should be eating vegetables as a meal as opposed to eating vegetables with a meal. In addition to that, if we're eating plenty of fruit and vegetables, we'll be getting plenty of vitamins and flavonoids. We'll also be getting plenty of fibre in the diet. All of these factors are important. So a good diet can aid the prevention of atheroma. A harmful diet can be an etiological factor in the development of atheroma. Smoking is a big factor. Cigarette smoking is a major factor in the development of atheroma, and this seems to be particularly true in the case of peripheral vascular disease. So it's very important to teach young people not to smoke. People that have been smoking for a long time often say, well, it's too late, the damage is already done. But with smoking, that is not true. And we'll look at why it's not true later. But for now, let's note there is advantage to stopping smoking at any stage. Lack of exercise is a factor in the development of atheroma for quite a few reasons. Exercise opens up the blood vessels and improves the circulation. Exercise also increases the amount of the protective high density lipids in the plasma. Diabetes mellitus. Is certainly a factor. In fact, diabetes mellitus and smoking seem to be 2 of the main factors in the development of ischemic limb disease. The key thing with diabetes is how well it is controlled. If a patient has good glycemic controls and near normal levels of blood sugar, then the long-term complications of diabetes, such as peripheral vascular disease, the chances of that will be minimised. Another factor in the etiology is hyperlipidemia. Or indeed dyslipidemia, where there is low levels of the protective high density lipoprotein or high density of the harmful low density lipoprotein. So high cholesterol, or conditions where the high density lipoprotein, which of course remember is protective, is low, or where the harmful low density lipoproteins are too high. Another factor in the development of atherosclerosis is obesity. Patients that are overweight are more likely to develop atherosclerosis than people that are not overweight. Another factor is if a patient has low levels of thyroxine in the blood, if there is a reduced thyroid function. hypothyroidism is an etiological factor. Psychological stress is probably another etiological factor as well. So we can see here there's quite a few factors that we can modify to prevent the etiology of peripheral vascular disease. Diet can be modified, patients can stop smoking. Levels of aerobic exercise can be increased. We should exercise half an hour most days. Diabetes can be controlled. Hyperlipidemia and dyslipidemia can be controlled with diet, exercise, and if necessary, medications such as statins. Obesity can be combated by exercise and diet. Thyroid function can be controlled by, well, you can increase the amount of thyroxine in the blood certainly by giving thyroid tablets. Psychological stress is a little more difficult to control, but we can work on that one. So quite a few lifestyle factors there which are open to modification. So these all lead to the chronic form of the disorder because they lead to the development of atheroma of the leg arteries. Let's think now about the acute form. Well, the acute form, as we saw in the little diagram we did before, you can get an acute obstruction as a result of the development of a thrombosis. If there is a large thrombosis, maybe high up in the femoral artery, then that can cut off most of the blood supply to the leg, and the person will develop an acute critical limb ischemia. Most cases of acute limb ischemia actually are caused by thrombosis, maybe 60% of cases